Okay, hello everyone. My name is Aliona Artini. Me and with my colleague Julia Burns, we are going to talk about gonorrhea versus chlamydia in this PowerPoint presentation. So chlamydia and gonorrhea are among the most common sexually transmitted infections worldwide. They are both caused by bacteria, but they both have different symptoms, treatment regimens, and public health impacts. This presentation will compare these two STIs in terms of their structure, transmission, treatment, and public health implications. So we're going to start with the scientific name and structure. Starting with chlamydia, the scientific name is Chlamydia trachomatis. Gram stain is a gram-negative bacteria. Structurally, it is an intracellular bacterium, which means that it must live inside the host cells to reproduce. It has a coccoid shape, biphasic life cycle, and elementary bodies and reticulate bodies. If we talk about gonorrhea, the scientific name is Neisseria gonorrhea. It's also a gram-negative bacteria, and the structure is a diplococci, and which means that it's paired in pairs of two spherical cells, and it has villi, hair-like structures for attachment to host cells, and IgA proteases to evade immune defenses. Continuing to the body system that are affected by these two microorganisms. So chlamydia affects mainly the reproductive system. In women, it can cause cervicitis and pelvic inflammatory disease, or also called PID, which can lead to infertility. In men, it can cause urethritis, pain, and swelling. Another body system that is affected by chlamydia is the urinary system. In the urinary system, it can cause painful urination and discharge, particularly from the urethra. The rectal system is also affected, and this happens through anal sex, which can lead to rectal infection, causing pain, discharge, and bleeding. Throat is affected by chlamydia by infecting the throat area, causing mild sore throat symptoms. Eyes can also be affected. In the eyes, it can cause conjunctivitis, especially in newborns or through direct eye exposure. If untreated, it can cause serious complications, but it is easily treated with antibiotics. Body systems affected by gonorrhea are also the reproductive system, which in women it can cause pelvic inflammatory disease, or PID, which also leads to infertility, similarly to chlamydia. And man, it can cause urethritis, pain, and swelling. The urinary system, it often causes painful urination and discharge, especially in the urethra. The rectum is also affected in gonorrhea. The infection can cause rectal pain, discharge, and bleeding, especially from anal sex. Throat, so pharyngeal gonorrhea can lead to a sore throat and difficulty swallowing. Gonorrhea in the bloodstream. In severe cases, it can spread to the blood, causing joint pain, rashes, and septic arthritis. And finally, it also affects the eyes, just like in the case of chlamydia, which causes conjunctivitis, particularly in the newborns during childbirth. Modes of transmission. So, chlamydia is transmitted primarily through unprotected sex, sexual contact, vaginal, anal, or oral. Can be passed from mother to child during childbirth, causing eye infections or pneumonia in newborns. If we talk about gonorrhea, it has a similar transmission mode through sexual contact, vaginal, oral, or anal. Can also be passed from mother to child during childbirth, leading to gonococcal conjunctivitis. The reservoir, so gonorrhea is found exclusively in humans, particularly in mucosal surfaces such as the genital tract, rectum, throat, and eyes. Chlamydia is also found only in humans, and it affects some mucosal surfaces like genital, rectal, and throat areas. In both cases, humans are the only reservoir for these infections, meaning they can only be transmitted from one person to another through sexual contact, or in the case of gonorrhea, from mother to child during childbirth. The geographic distributions of these two diseases. So, the global prevalence of gonorrhea. Gonorrhea is found worldwide with higher rates in regions with limited access to healthcare and higher rates of unprotected sex. Higher rates are in the United States, Sub-Saharan Africa, and parts of South and Southeast Asia report the highest rates of gonorrhea. Another factor is antibiotic resistance, that gonorrhea is increasingly resistant to multiple antibiotics, making it more challenging to treat, particularly in high-income countries. There are some regional trends in many parts of Europe and North America. There has been a rise in antibiotic-resistant gonorrhea, particularly in major cities. It also can become a public health burden because gonorrhea remains a significant concern in both developed and developing nations due to its complications like pelvic inflammatory disease, infertility, and neonatal infections. The geographic distribution of chlamydia. So the global prevalence of chlamydia is the most common STI worldwide and is widespread in many regions, especially in high-income countries where screening is more accessible. There's higher rates like gonorrhea. Chlamydia is most common in North America, Europe, and parts of Australia. The highest rates are seen among young sexually active individuals between ages of 15 and 24 years old. Rural versus urban. So chlamydia is more frequently reported in urban areas due to more frequent screenings and diagnoses. There are undiagnosed cases. So there are cases that often remain undiagnosed due to its often asymptomatic nature, especially in women, meaning its true prevalence might be underreported in many parts of the world. There has been an increase in the reported cases of chlamydia globally, particularly in Europe, North America, and Australia, largely due to better detection through increased screening efforts, like I mentioned before. Here we're going to discuss some virulence factors of chlamydia. The virulence factors of Chlamydia trachomatis enable it to infect the host cells, evade the immune system, and cause disease. Some key factors include intracellular lifestyle, which means that chlamydia is an obligate intracellular pathogen replicating inside the host cells, which protects it from immune detection. Type 3 secretion system. This system injects effector proteins into the host cell and this is facilitating bacterial entry and survival within the cell. Um, Another valence factor is the inclusion body formation. Chlamydia creates a membrane-bound inclusion inside host cells where it replicates and avoids immune responses. Um, Immune evasion, it suppresses the host immune response by inhibiting cytokine production and antigen presentation, helping it evade detection. Chronic infection which means that chlamydia can enter a persistent state, evading the immune system and causing chronic and recurrent infections. Endotoxin, lipopolysaccharides on its outer membrane trigger inflammation and contribute to tissue damage, and also prevention of host cell death. It inhibits apoptosis cell death following continued infection and replication. The virulence factors of gonorrhea. Pili, which aid in adhesion to the host cells. So there are outer membrane proteins, example OPA proteins, which facilitate adhesion and invasion. There are antigenic variations which help evading immune detection. Lipopolysaccharides, which trigger inflammation and tissue damage. IgA proteases, which break down immune antibodies and help evade mucosal defense. Type 4 secretion system, which promotes bacterial motility and DNA transfer. And complement resistant, which evades immune system destruction by binding factor H. And cell invasion, which allows survivals inside host cells, avoiding immune detection. And these factors contribute to gonorrhea's ability to cause persistent infections and evade the host immune system.
Alrighty. So some means of prevention. So on this slide, I kind of joined chlamydia and gonorrhea because they have very similar means of transmission, and so means of prevention are also very similar. So there are currently no approved vaccines specifically for chlamydia or gonorrhea. And so one of the top prevention methods would be abstinence from all forms of any sexual interaction. And also protection in the form of condoms or dental dams would also be a very prominent means of prevention if you are sexually active. Also to limit sexual partners would be another method. Also, simply knowing if your potential partner is symptomatic or has an active infection, so keeping up with testing. And also, especially with gonorrhea, antibiotic eye ointment for prevention of gonococcal eye infection in newborns would be a prevention method as well. So the next couple slides are going to be some stats and graphs that go along with chlamydia and gonorrhea. So in this approach right here, it's talking about the different populations affected. So in the first figure, it talks about chlamydia cases, and then figure 2 talks about gonorrhea cases. And so already mentioned previously, but age group 15 to 24-year-olds have the higher prevalence in chlamydia and gonorrhea cases. So definitely the younger population are highly affected. And in chlamydia cases, you will notice that females have a higher prevalence. And then in men, there is a slightly higher prevalence to have gonorrhea. But it's more equally distributed with gonorrhea in comparison to chlamydia. It's very more highly prevalent in females. And then for treatment for chlamydia, it normally takes about 7 to 14 days for treatment. Doxycycline is given as an antibiotic with a 7-day dose. Azithromycin can also be given as a single dose, and that's predominantly given to people if they are pregnant. And so the mechanism of action based on this treatment is it inhibits the bacterial protein synthesis method. And then for gonorrhea, slightly different approach for treatment, but it comes in the form of an injection, cefotraxone. And if you happen to be allergic to this injection, 1 shot of gentamicin or an oral azithromycin can be given. And then doxycycline can be prescribed to help treat if chlamydia is also present, which is kind of known. They're known to kind of be present together at times. So doxycycline is a very good antibiotic for treating that. It also clears up within 7 to 14 days. And then there's also super gonorrhea, which has high levels of antibiotic resistance. And so that one has a harder time treating. And the mechanism of action for this is inhibits the mucopeptide synthesis in the cell wall and cell wall synthesis and cell division. So a little different mechanism of action. Um, and then populations affected. Again, this is kind of a mix of chlamydia and gonorrhea because populations are kind of similar. So if there's a history of STIs, those populations where heavily prominent STIs are prevalent, they have a higher chance of getting chlamydia or gonorrhea. HIV positive or have other STIs increase the risk, especially of gonorrhea. And continuing the same practices that you have been doing before can also contribute to higher prevalence of these STIs. Having multiple partners, there's certain populations that is more common and they are more affected. Male to male sexual interactions are also um, have a higher risk. And then people who work as sex workers also are highly affected by these two bacterias. And like we said earlier, the younger population, right around age 25, so age under 25 are also a population affected. Some things that might have to do with this is lack of education and or access to protection. And so those go hand in hand. And then kind of with chlamydia having those higher prevalence numbers in women, young women are also highly susceptible. Um, and then here's another graph right here, just to show the difference in chlamydia and gonorrhea based on gender again. And so right here you can see chlamydia is highly prevalent in females, still prevalent in men, but definitely higher values right there. But yeah, thought that was an interesting graph to see. And then right here we have chlamydia and gonorrhea cases based on like racial and ethnic groups. And so right here you can see there's the variations in how these bacteria are spread among different populations. And so the African American culture have a higher value of chlamydia cases. That doesn't discount any of the other groups as well, just because they all have higher values as well, higher than we would like to see. But you can just see kind of this escalating trend. And also in gonorrhea, you can also see the higher values in the African American population and lower in the Asian culture. And then once again, we had another graph right here. So we kind of already discussed it based on the age group. So just because we say it's higher in people under the age of 25 doesn't mean that there isn't a decent prevalence in higher age groups as well. You can see right there that age group up to 34 also have a high prevalence as well. And so some public health challenges that come with both these is the lack of a vaccine that is used to treat or prevent either of these bacterias. Access to treatment, that is a public health challenge, especially in underdeveloped countries, but also in developed countries. As mentioned earlier, the United States also has a really high prevalence, and we are a developed country, but access to treatment and well-known access to treatment is definitely a challenge. And then safe sex materials and also education to younger populations and understanding the practices that should be implemented as prevention. And then also in chlamydia, a public health challenge also mentioned earlier, but it's just the reproductive health and damage that can be done, especially in women and that infertility, the pelvic inflammatory disease, as well as arthritis, eye infections, and an increased risk of HIV. And then in gonorrhea, antibiotic resistant strands are a big public health challenge. Ceftriaxone is the antibiotic that's commonly used, but there's that super gonorrhea bacteria that has become resistant to some strands. And then if untreated, like again, can also lead to the pelvic inflammatory disease, infertility, neonatal conjunctivitis, and then other disseminal gonococcal infections, which can affect multiple organs and also increase risk of HIV. And so both of these bacteria present pretty big public health challenges. So some potential solutions. Again, for both of these, chlamydia and gonorrhea, is education. Education's a big solution for a lot of um, conditions out there, but in this case, just prevention, treatment, and transmission, educating younger population, considering they are the highest statistically proven cases of chlamydia and gonorrhea, just to really show prevention methods um, and how to treat it and get on top of it and to prevent the transmission of it. And then also the importance of testing if at risk. And so, yeah. Another method is prevention, of course, so access to protection methods and frequent testing. And so there's opening the door for more opportunities. And making it maybe more easily accessible for populations that don't have easy access to these methods. Vaccination, so a development of an effective vaccine would be a very big potential solution in stopping the spread of these bacteria and hopefully preventing maybe some of those additional health concerns that come with these bacteria being untreated. And then also like awareness. I feel like in general, sexually transmitted like, diseases have just like a stigma, and they kind of always have. But I think it's gotten better a little bit. But just making that cultural acceptance and understanding that there is methods of treatment and there's ways to prevent this and just to take care of each other and not to put each other down. So just making awareness to these different solutions for sure. And then this is kind of just chlamydia and gonorrhea in a short sense, just in a table. They're both pretty similar. They're definitely different bacteria, but they're very similar in the sense of how they are treated and how they are spread and how they can be prevented. And so they're both sexually transmitted bacteria. They're both gram-negative. Chlamydia is that there's cocci, and then gonorrhea is the diplococci. So there's different uh, morphology. And then they both affect the reproductive system, and the rectal, urinary, eyes. Chlamydia can affect that throat more with the oral sex. And then they both are treated with antibiotics and usually clear up within 7 to 14 days. The difference is gonorrhea uses an injection commonly, and there's a big concern for that antibiotic resistance strand when it comes to gonorrhea. And chlamydia, like we said, same with gonorrhea, increases risk of HIV, reproductive health concerns as well are some of the biggest things. Chlamydia more common in females, and gonorrhea more higher prevalence in males, but they're both pretty similar in a sense. And then just some interesting history facts. So gonorrhea, gonos in Greek, so that prefix right there means semen or seed, and rhio means to flow. So I think that's interesting to see how we have now used the Greek meanings of this bacteria to now describe how this bacteria is spread. And then chlamydia means cloak. And so the bacteria is known to quote unquote cloak the nucleus of the cell, but now that is technically deemed incorrect. But the name's kind of stuck around. So I thought that was kind of interesting to learn. And here are all our references and the information on how we've compiled this presentation. And I thank everyone for listening to our presentation. And I hope you walk away learning just some more information about gonorrhea and chlamydia. And we look forward to listening to all your presentations.